What's up, guys? It's Matt. Just shooting a quick video this morning. Give you guys a little update on what's going on. So basically, last week we just went through a lull, going through lectures, cardiopulmonary MP, doing that cardiovascular system, and basic therapeutics. We've been working on aerosol therapies, humidification, SVNs, and stuff. So, I guess two things I want to talk about this morning. One of them being my upcoming simulation. So it's not this week, it is next week. We were basically given our scenario already just to kind of help prime us, just information about the patient. That way we can start kind of thinking about possibilities for what we'd be doing for this person, and some guidelines, like he referenced some stuff from our book to read, as well as some of the therapist guidelines to look over. So that'll be pretty cool. It's just I guess it's kind of standard stuff. It's a 84-year-old and with shortness of breath secondary to COPD. He also has an ulcer on his leg that came back MRSA positive, so we'll be donning our PPE. So that'll be fun. So if you've done any simulation before, definitely if you have any advice for me, that'd be nice. Definitely, it's like our first step to really what to come to expect next semester when I actually start clinicals. So yeah, if you have any advice for that, I'd appreciate it. That's awesome. The other thing that I want to talk about, so this week my school's doing something kind of unique for us anyway. It's our first annual Respiratory Care, Respiratory Therapy Conference. So our school's decided that it'd be cool, to do something. We're actually, I think next summer, AARC is doing their big conference in Tucson. So that's kind of cool, and that's actually something we're planning to do, because in the summertime we just have clinicals and we get our ACLS. So we'll actually get to go as students to one of their major conferences, which is pretty cool. So our conference obviously is not huge. We're not inviting 40,000 schools from all over the country and stuff like that. We're inviting the other major program in town to come with, and the speakers include some lead or charge RTs from some of the hospitals in the area. I think there's a lead charge from a long-term care facility who's going to be speaking. The medical director, so the doctor, the physician who oversees our program, basically every respiratory therapy program has some sort of a medical director that oversees the whole thing. He's going to be speaking about sleep disordered breathing. The president of our respiratory club will be speaking. So it seems like it'd be a pretty cool experience. So I don't know if anyone else's schools regularly do something like that, or if you attend any of the other maybe national conferences or state chapter conferences and stuff. So I just thought that'd be a cool experience. I'll definitely, that's actually this coming Thursday. So I don't know if I'll shoot any video of that, because they're trying to make it as close to a professional or business casual thing as possible. So I don't know how much video I'll get from that, but I would definitely do an update after that, just to kind of let you guys know how that went. And then if anyone has any advice, I've been having a lot of discussions about what is business casual. Is that basically dressing up minus the tie? Can you be what I call like the Steve Jobs? Can you rock like a polo or maybe a long sleeve that's tucked into a pair of jeans with nice shoes? Obviously a non-distressed jean, like not tattered or anything like that, but a nice dark wash jean. I guess I like to err on the casual side because my prior job I was basically forced to wear a very standard definition of business casual for 2.5 years, and it was awful. So I'm just trying to see what you think my professional limits are there. We will be having the opportunity, of course, to meet 2 or 3 lead and hiring RTs from a few of our local hospitals. So obviously you want to make a decent impression on those guys. I don't want to be slummed out. But if you have any advice for me on that too, definitely let me know, guys. As always, thank you so much for watching. I'm glad 72 subscribers, guys. That's awesome. I think over 5,000 views now on the channel. So thank you, guys. That's all you. You keep watching them. I'll keep making them. Like, subscribe, comment, guys. And everyone have a great day.